Hi guys, welcome to Fast21 Medical Coding YouTube channel. The purpose of the channel is to help the people who are in need of medical coding reliable resources. So if you are already subscribed to our channel, help your friends to subscribe. If you are visiting for the first time, then click on subscribe button to receive future updates in medical coding field. Basically the channel is helpful for freshers, experienced coders, aspirants of AAPC certification exams, and AHIMA certification exams. If you have any other topics or concerns, please mention in the comment section. Please click on the like button to encourage and motivate us. Please watch until the end to gain in-depth knowledge about ICD-10 CM, CPT, ECPIX coding systems, as these QA sessions are very useful in live coding, medical coding interviews, CPC and CCS certification process. Guys, if you go to any interview, keep familiar with books like ICD-10 CM, CPT, ECPIX, as our sessions will assist you in the process of interviews and examination, but not an alternative to original interview process or original examinations. So today our topic is ICD-10 PCS tricks and tips part 1. Question 1. What is a character in PCS? Answer. An accept classification that specifies information about the procedure performed. Question 2. What is a value in PCS? Answer. Value means one of the 34 letters or numbers that can be selected to represent one of the characters in an ICD-10 PCS code. Question 3. What is approach? Answer. Approach is the fifth character in the code in the medical and surgical section, the way the procedure site is reached. For example, if you take open or percutaneous. So approach is very important whether if you are coding in CPT or in PCS also. Based on approach only we need to code the document. Question 4. What is a qualifier? Answer. Qualifier is the seventh character in the code in the medical and surgical section. It carries additional information for that particular procedure. So it will provide extra information about the procedure. Question 5. What is root operation? Guys, in ICD-10 pieces, root operations are very important. In part 2, we will make one session on all the root operations which are in ICD-10 PCS. In this session, we will learn what is a root operation. Answer. Root operation is the third character in the code in the medical and surgical section corresponding to the objective of the procedure. In this section alone, there are 31 possible objectives. Question 6. What is the first character? Answer. First character is section in ICD-10 PCS code. Question 7. Which body part divides upper and lower? Answer. The diaphragm is used as the frame of reference for body part values classified as upper or lower in the upper arteries, lower arteries, upper veins, lower veins, and muscles and tendons body system. So basically it is a partition among the upper and lower parts, which is diaphragm. Question 8. How many root operations exist in PCS? Answer. We have 31 root operations in PCS. Question 9. If the physician documents partial resection, which root operation you will consider? Answer. If the physician documents partial resection, I will use root operation excision, as we have resection also in ICD-10 PCS root operations, which is different than the excision. Excision means partial resection of the body part or anything. Question number 10. If the procedure performed an alveolar process, how can you code? Answer. If a procedure performed an alveolar process of the mandible would get coded to the whole the mandible body part. So basically alveolar is a part of the mandible. So we need to code as mandible as complete body part to code procedure performed on a alveolar process. Question 11. Which body part you can take to code the procedure of perirenal area? Answer kidney. As you know, renal means related to kidney. So usually anyone can tell this answer. Perirenal means related to kidney. Otherwise surrounding the kidney. Question number 10. How do you code if the procedure is performed on continuous section of a tubular body part? Answer. If a procedure is performed on a continuous section of tubular body part, we need to code the body part value corresponding to the farthest anatomical side from the point of entry. So we need to code the farthest means distance anatomical side from the point of entry. Question number 13. How do you code if the procedure is performed on mandibular branch? Answer. If a procedure is performed on the mandibular branch of the trigeminal layer, is coded to the trigeminal layer body part value. So here also like previous answer, here also we are taking body part as the trigeminal layer, as mandibular branch is the part of trigeminal layer. So we need to code as trigeminal layer body part value. Question number 14. How do you code occlusion of the bronchial artery? Answer. Occlusion of the bronchial artery is coded to the body part value upper artery in the body system upper arteries. So as you know, bronchial means related to the lung. So these arteries are related to the bronchial area. So we need to code it as upper arteries. Question number 15. How do you code procedure performed on bilateral body parts? Answer. If the identical procedure is performed on both sides and a bilateral body part value exists for that body part, the procedure code is assigned once using the body part value. So for example, if any procedure run performed on the right side and left side, if we have bilateral body part code, we need to code that code only. Question 16. How do you code if there is no bilateral body part code is not available in PCS? Answer. If no bilateral body part value exists, we need to code each procedure should be coded separately using the appropriate body part value. So it is common. If you don't have bilateral body part, we need to code separately. Question 17. If a procedure is performed on the skin, subcutaneous tissue, or fascia overlying a knee joint, how do you code the procedure? Answer. Knee joint is coded to the lower leg as it is in the lower body part. Question 18. How do you code excision of a finger tendon? Answer. Excision of finger tendon is coded to one of the hand tendon body part values in the tendon's body system. Question 19. How do you code laparoscopic assisted sigmoidectomy? Answer. Laparoscopic assisted sigmoidectomy is coded to open based on the guidelines. Question 20. Which approach you can use for resection of tonsils? Answer. External approach as tonsils are visible without the aid of any instrumentation. So as tonsils are visible outside, we need to take it as external approach to code resection of tonsils. Question 21. How do you code fragmentation of kidney stone via percutaneous nephrostomy? Answer. Percutaneous. As question itself is having percutaneous, we can code it as percutaneous nephrostomy, like percutaneous approach. Question 22. How do you differentiate open and percutaneous approach? Answer. Open procedure, there is cutting, which means there will be suturing of the skin when they are done. So, whereas in percutaneous procedure, they either just nick the skin or use a needle in the band A to close up instead of sutures. So, another distinction is in an open procedure, they cut you open, and in a percutaneous procedure, they poke it through. So basically, if open procedure performed, physician will make the cutting, and after completion of the procedure, they will suture the incision sites. Whereas in percutaneous procedure, there is no need for sutures, just physician will help with bands or stickers. Question 23. Icd-10 Pcs approaches through the skin or mucous membrane. What are those? Answer. Open, percutaneous, percutaneous endoscoping. Question 24. How do you code excision slash resection followed by replacement. And can you tell me one example for that? Answer. If an excision or resection of a body part is followed by a replacement procedure, we need to code both procedures to identify each distinct objective except when the excision or resection is considered integral and preparatory for the replacement procedure. So for this, most common example is mastectomy followed by reconstruction. Both resection and replacement of the breast are coded to fully capture the distinct objectives of the procedures performed. Very easy example, mastectomy. Question 25. How do you code percutaneous endoscopic approach with extension of incision? Answer. Procedures performed using the percutaneous endoscopic approach with incision or extension of an incision to assist in the removal of all or portion of a body part or to anastomose a tubular body part to complete the procedure are coded to the approach value percutaneous endoscopic. For this also we have an example. Laparoscopic sigmoid colectomy with extension of stapling port for removal of specimen and direct anastomosis is coded to the approach value percutaneous endoscopic. Question 26. How do you code if an interbody fusion device is used to render the joint immobile? Answer. This procedure is coded with the device value interbody fusion device. So fusion is the procedure to limit the movement of the vertebrae, to decrease the or to reduce the pain. This is part 1. Soon we will make part 2 also. And if you have any concerns, please mail at fastcoded21@gmail.com. Please encourage us by click on the like button, or if you have any concerns, please mention in the comment section so that you can reach us. Thanks for watching Fast Coded 21. Happy coding, guys.